Hey there, and we are live. I'm Dr. Jolene Brighten, and we're going to chat about hormonal contraceptives and depression. So let's have some real talks. I got to break some stuff down for you. Women taking the combined contraceptive pill, that is synthetic estrogen and synthetic progesterone, are 23% more likely to be prescribed antidepressants. Gets scarier. If you are a teen and you start the combination pill, you're 80% more likely to be prescribed an antidepressant. And it keeps going. So a lot of the times women say to me, well, if the issue is the combination pill, then, what about progestin only? Like I have an IUD and, or I get the depo shot, and that surely doesn't have a higher risk, right? Well, what we found out from studies is that women taking progestin only pills are 30%, more than 30%, actually 34% more likely to be prescribed an antidepressant. And who do we give a progestin only pill to? This tends to be the prescription that we give to new moms who are at highest risk for strokes and for blood clots forming. And so keep this in mind. If a woman has a baby, she's more likely to be prescribed the progestin only pill as a means of contraceptive. And keep in mind that this pill doesn't work as effective as the combination pill, but she's given this because she's at higher risk for forming a clot. However, she's also 34% more likely to be prescribed an antidepressant. This is why we need to question hormonal birth control. Because when it comes to postpartum depression, is she really depressed, or is it the medical intervention by way of the mini pill that you gave her? Now, what about teens and the progestin only pill? What we found from the research with teenagers in particular is that they're 2 times more likely to be prescribed an antidepressant if they're taking a progestin only pill. Now, this is where I said it keeps going and it gets a little bit scary. Teens are at least double the risk of suicide after a year of being on hormonal birth control. So they're 30% higher after 7 years on hormonal birth control of committing suicide. So when teenage gals start hormonal birth control, they're at a higher risk of being prescribed an antidepressant. They're at a higher risk of committing suicide. And the suicide risk peaks around 2 months from beginning hormonal birth control, but it can persist. So they're still at double the risk a year later. So we need to talk about this because you may have heard that hormonal birth control cannot or does not cause depression. So why do doctors say this? Why do doctors, despite it being in the package insert, despite it being something that women have complained about since the introduction of the pill back in the 1960s when it really stepped on the scene, widely used in the general public? Well, because we don't have a study that says causation. So we don't have a study at this point that says you take the pill, it causes depression. We don't really know the mechanism of action. Although, as I talk about in my book, Beyond the Pill, we've got a few ideas of what is going on here. And so I want to spend some time chatting about that. And then we're going to do a Q&A. So I'm live on YouTube and I'm live on Instagram as well. So hello, everyone. Say hello to me. I want to explain a few things to you. And then I want to go into a quick Q&A session. So here's the deal. With hormonal birth control, women have described depression, anxiety, mood swings, and other mood-related symptoms since the introduction of it. It is in the package insert of these pharmaceuticals. And we have to keep in mind that while hormonal birth control is ubiquitous in our society, it is a medical intervention and it is a medication. So whether that's the pill, the patch, the ring, the IUD, the shot, it's the implant, really any form of hormonal birth control is correlated with an increased risk of depression. Now, we had a study come with over 1 million women demonstrating the same statistics that I just shared with you. So that was born out of a study, an epidemiological study of over 1 million women, and that can show correlation that you're more likely to be prescribed a mood-altering medication once you start hormonal birth control. We do not have the research to say causation. So doctors are very cautious about this, and doctors and scientists are pretty dismissive of women's stories. So here's the deal. Track your symptoms before you ever start hormonal birth control. If you've already started it and you start having mood symptoms, that warrants a discussion with your doctor. But how is it that hormonal birth control may very well be inducing these mood effects in women? So there was a study that came out and showed that there is an inflammatory component to hormonal birth control. As I talk in my book, Beyond the Pill, in the chapter on taking charge of your mood and getting rid of your anxiety, depression, I go through how hormones are related to our mood. So your brain is actually really rich in receptors for your sex hormones, estrogen and progesterone. Now, progesterone stimulates the GABA receptor in your brain, which makes you feel really chilled out and calm and in love with life. Progestin, that synthetic stuff that you get in hormonal birth control, not the same thing, doesn't do the same thing. So you don't get the same impact with that. Now, a study came out and showed that, okay, so we've had multiple studies showing the inflammatory effects of hormonal birth control. There tends to be two camps when it comes to depression. There's the serotonin theory of depression, and there's the cytokine theory of depression. So let me break those down for you. I'm going to start with the cytokine theory of depression. Now, this says that really the issue with depression is we've got inflammation going on in the brain, and it messes with how we process neurotransmitters, but I think more importantly, it actually causes us to make neurotoxins. So a study came out, and I detail this in Beyond the Pill. You can pick up a copy and check it out if you want to nerd out on this even further. Now, this study showed that if you start hormonal birth control, they'll measure your CRP, C-reactive protein. You start it, it's elevated. So you are more inflamed when you're on hormonal birth control. Now, an additional study hypothesized that the reason why women have mood-altering effects when they begin hormonal birth control, anxiety, depression, mood swings, panic attacks, things like this, is because what actually happens is that hormonal birth control disrupts the tryptophan pathway in your brain. Tryptophan goes like this. Tryptophan goes to serotonin, goes to melatonin. And so that's like, we think of serotonin often as the happy mood neurotransmitter. Know that too much of a good thing is too much of a good thing. So that's the serotonin theory of depression. But what happens in the cytokine theory of depression is what happens specifically when you're on hormonal birth control is that you make neurotoxins in the brain. So in that tryptophan pathway, we should make kynurenic acid, which is like, love up your brain. And instead we make quinolinic acid, which is like, I hate you, brain. Hate you. And so, real talk, you make neurotoxins in your brain when you are on hormonal birth control. So, if you subscribe to the inflammatory or the cytokine theory, cytokine are the chemical messengers of the immune system that can get you all hot and bothered with inflammation. We know, like, for example, one cytokine, interleukin 1, if that gets elevated, you pissed off. Like that hits your brain and you were pissed. Like you were angry. Girl, that ain't you, okay? That's your cytokine. So that's the cytokine theory of depression. So that's one mechanism in which birth control may, in fact, be causing depression. We need more studies to use the cause word. Now, the serotonin theory of depression, which has been like the leading theory for decades, despite there not being substantial evidence to really support that. And, you know, if you're interested in more of that, we should probably do another session on that specifically. But with that, this theory says you don't have enough serotonin. That's why you're depressed. And serotonin is our happy neurotransmitter. Well, this is getting a bit debunked here because, you know, the thing we've come to understand is you make the majority of serotonin in your gut, which is where your immune system lives. The majority of your immune system lives in your gut. So it circles right back to that immune inflammatory cytokine theory of depression. But if you do subscribe to the serotonin theory of depression, like right now, we don't totally know. So like we've got to be asking the questions and stay open to everything. But with serotonin, we need crucial nutrients to really run that tryptophan pathway. B vitamins, oh snap, depleted by hormonal birth control. Magnesium, so that we can run that pathway and get all the way to our melatonin, which is a neuroprotective antioxidant. Yes, it helps you sleep. It also protects your brain and your ovaries. Love me some melatonin. So with that, if you're taking hormonal birth control, and we know that it depletes nutrients that are needed to actually create serotonin, then we can understand that could be another possible mechanism of depression. Now, as I said, the majority of serotonin is made in your gut. And as you'll learn about in Beyond the Pill, hormonal birth control messes with your microbiome. So it actually lowers microbial diversity, and research has said it's similar to the antidepressants also lower your microbiome to an antibiotic. That's where I was going with that. And we have to recognize We don't stay on antibiotics for like decades at a time, but we sure as heck do that with the pill. This gal did 10 years herself. That's why I don't judge anybody. If you got to use the pill, I got you on that too. So here's the deal though. If we are taking a pharmaceutical that actually disrupts the healthy flora in our gut and how our gut functions altogether, and I'm telling you that you make the majority of your serotonin there, that's just one more place that we can see, maybe this is how the pill and the mini pill and these other forms of hormonal birth control cause depression. Again, we can't use the cause word yet because we don't have a study that's actually shown us that, like, yes, it does cause that. So when I say this, this is all hypothesis. Like, we need to test these things and figure out what is true for us. So what do we do? Like, what if we got on hormonal birth control and we do notice our mood is changing? I've had lots of patients go through this, and a lot of women come to me because they notice they got the IUD placed and now they're finding that they're really anxious, or maybe they are postpartum and they started hormonal birth control postpartum because they don't want another baby. I don't blame them. After I went through childbirth, I was like, please no more babies for a while here. And with that, they can get started on the mini pill. As I said, if you missed it, you want to go back, rewind, listen again. The mini pill and progestin only are actually correlated with higher incidence of being prescribed an antidepressant, and so being diagnosed with depression. And so we got to slow our roll, especially the new moms. Like if she comes to us, comes to me as a doctor and says, I'm depressed, we need to recognize that, one, being a mama in the modern world is not easy. And two, if she had a medical intervention like progestin only contraceptive, that may very well be the root cause of her mood symptoms. And the solution here isn't to put her on more medications, but it's really to remove what's obstructing her, what could be causing those side effects. And it's kind of funny we call it side effects because they're like known effects. It's like, this is not a side effect. This is like what happens when we use these things. So if you are a woman who has ever started or used hormonal birth control and noticed mood changes, know that you are not alone. It's actually a quite common thing for women to report. And like I said, you can check the package insert. And if you do have mood symptoms, you need to see a doctor and you need to discuss, is it hormonal birth control or is something else going on? And certainly if your birth control isn't working for you, you may need to switch to a different form. Or as I talk about in the On the Pill, you may need to consider coming off of it, really working to rehabilitate that mood and get your mood back on track before you consider using more hormones. Now, we know that our natural sex hormones do impact our brain and our mood. And doctors will often prescribe hormonal birth control because they're like, it's those cyclical hormones that are causing your mood symptoms, therefore take birth control. We can get rid of those mood symptoms. If that's the logic your doctor uses, then there should be no reason to dismiss that the synthetic hormones may very well impact your mood as well, although some doctors do. Some doctors will say, oh, there's no evidence of that. But we don't have to have evidence when we understand basic physiology and we understand that this human is sitting in front of us saying, I have issues now. We investigate. We do lab testing. So some of the lab testing that I talk about in the On the Pill is getting a C-reactive protein done. So HSCRP is a marker of inflammation. You can understand if you're inflamed. You can also get an organic acids test, which is going to tell you about neurotransmitter metabolites and nutrition status. And certainly if you're on hormonal birth control now, like I said, if you're having mood symptoms, you want to chat with your doctor. You may also want to consider starting something like a prenatal or multivitamins to replenish nutrient stores. So we want to get our nutrient stores up. Specifically B6 and magnesium is really helpful in this pathway. But like I said, we may be dealing with a couple of mechanisms here. So we have to consider we want to replenish nutrient stores, but we also need to drop inflammation. Using something like a bioavailable turmeric supplement or including turmeric in your diet can be really beneficial in dropping inflammation. And like I said, a lot of these issues are taking place in the gut. We know from research. So let me just give you one example. There was a research study in which they had mice with sterile guts, and they found they were really, really anxious. Then they inoculated them with one strain of probiotics known as Lactobacillus rhamnosus, happens to be in high concentration in the vagina. And what they found after that is that they were far less anxious. So we know what grows in our gut impacts our mood as well. Is the answer to go and just start one single strain of probiotics? No, the answer is to nourish your terrain. Like I teach you in Beyond the Pill, how to really love up your gut, right? So good guys want to grow there and bad guys, they can't hang out. And then look at taking a high quality probiotic. I usually start with a spore-based probiotic in the clinic, and I'll share some links with you guys so you can see what I'm talking about. I also detail this in my book. So if you're like, I just want the whole protocol, there's a whole gut protocol, a whole mood protocol in there to really help you fast track your healing and all of that. So that's a few of the things that you can start to do is taking care of your gut with a probiotic, eating a variety of fiber, getting anti-inflammatory foods going and healthy fats that feeds your brain really well, and replenishing nutrient stores with something like my women's twice daily multi or the prenatal plus that I have. So I'd love to hear from you guys. Now I'm going to take some questions that I shared a bit with you guys about that birth control, depression, connection, and some of those statistics that we should be aware of before we ever pop hormonal birth control. And of course, always remember, you can go to drbrighten.com, tons of resources for you there. Check out my YouTube channel. I make tons of videos for you guys because I know we all learn a little bit differently. And of course, check out Beyond the Pill, which is a comprehensive women's hormone guide that will teach you how to take care of your gut, your mood, your liver, your libido, and a whole lot more. And stay safe, whether you choose to start or stop hormonal birth control. So I see that Rebecca's saying, it's sad because I didn't realize it changed, altered mood until I stopped taking the pill. So true. And, the mood symptoms don't just go away because we stop hormonal birth control. In fact, as part of post-birth control syndrome, they can get a lot worse. And that's where we can find that like maybe the depression sinks a little lower or the anxiety heightens, or maybe they start alternating, or maybe we feel enraged. And anything is really par for the course is post-birth control syndrome, because as you come off of hormonal birth control, your body's got to recalibrate and figure out like, what does it look like to be off of these hormones? Now, the hormones are designed to affect only your reproductive tract, but the truth is about hormonal birth control is it impacts every single system in your body, which is why post-birth control syndrome has so many different symptoms that go along with that. So I see a question about, does the book Beyond the Pill talk about endometriosis, how to deal with it? You just stop the pill and you're kind of scared of the pain. Yeah, girl, like with endo, I would definitely be a little bit scared of the pain too if it was me. So what I'll say to you is that you want to definitely grab Beyond the Pill, start checking it out. There is a review on Amazon about a gal with endometriosis who recommends the book. The book is designed for really any woman who would be prescribed hormonal birth control for her condition. So maybe it's PCOS, maybe it's endometriosis. There are pain solutions in the book and also mood solutions, which go hand in hand when we have chronic pain conditions as well. So I want to take a look here at all the questions coming in, make sure I answer those. And we're going to go about 10 more minutes here in answering questions. So Miss Apology, you took birth control for 4 years. You stopped, your face broke out, severe acne, talked to your doctor. They said to put me back on birth control, but I want to stop taking it. You definitely have to check out Beyond the Pill. There's a whole acne protocol in there, and I talk about why that happens and give you some solutions that were born out of my clinic, working one-on-one with women. That's where all the protocols in my book come from. They come from working one-on-one with real women like you, that I've helped, thousands of women on hormonal birth control and transition off. So I see a question about, should I start Balance and then quit the pill? So Balance, the Women's Hormone Support Supplement by Dr. Brighten, best to start that and the protocol and Beyond the Pill as soon as possible before making the transition. So if you guys have mood symptoms, the topic today is we're talking about birth control and depression, and I would love to answer mood symptoms. I saw something come up about turmeric. If you want to drop that turmeric question in for me again, then I can grab that and I can chat with you about it. So I see that HS Walker 88, I just stopped birth control 2 months ago. I don't have symptoms yet, but is there anything I should be doing? You want to check out Beyond the Pill. So I grab Beyond the Pill. It has a whole protocol in it. I also have a quick start guide. drbrighten.com/PBCS diet, post-birth control syndrome diet. That's what that stands for. And that's to help you fast track your healing and know what to do right away. Post-birth control syndrome symptoms tend to peak at about, they tend to come on 4 to 6 months after stopping birth control. So if you're at 2 months now, it may be coming for you, and I hope it's not. But if it is, I've got solutions for you in my book, Beyond the Pill. and also drbrighten.com/PBCS diet. That's a quick start guide to get you fast tracked and like, what can you be eating right now and what should you be looking out for? Now, the question about turmeric in your diet. So it depends on how we're using turmeric. So I formulated my turmeric boost to be highly absorbable and the constituents of turmeric that have been studied and researched and have the best effects in terms of the research. And so that's something we use when we're trying to drop inflammation fast in women. We want to support liver detox. We want to support brain health. We want to support ovarian health. And so if we are in a healing phase and we've got symptoms, bringing on supplements as part of our diet and lifestyle therapies can be highly, highly beneficial. With that, though, I do advocate for including turmeric in your diet, and you'll see there's turmeric recipes in Beyond the Pill. The reason for that is that is going to also give you fibers that'll feed the gut. So if you use that whole turmeric root, and that'll feed those little gut bugs as well. But keep in mind that if you're wanting to use therapeutic levels of turmeric, it's going to have to come by way of a supplement. So whenever you see a study that's like, turmeric can help X, Y, and Z, that's a supplement. So, when it comes to turmeric, I think that it really depends on where you're at. I flesh that out in further detail in my book for you so you can understand. Should I use a turmeric supplement? Should I just go away by way of my diet? Even if you use a turmeric supplement, I still encourage people to include turmeric in your diet. Does post-birth control syndrome always happen in every woman after stopping birth control? In some capacity, it does. It's a varying degree of how intense it is. So for some women, they might notice that like their periods feel a little bit off. For other women, they might have mild skin changes. There might be mild digestive changes. And then for other women, it's going to be the full extreme where they're having headaches and mood swings and they're noticing they're really depressed. They have digestive issues. Their liver feels sluggish. They're breaking out like crazy. And so in my clinical experience, I found that the majority, if not all of women, struggle in some way to come off of hormonal birth control. The biggest thing that I've seen when women don't struggle and they're like, actually, that wasn't so bad, they changed their diet and lifestyle before they came off of birth control. And so that's what I teach you to do in Beyond the Pill. I hope that every woman who gets Beyond the Pill can prevent post-birth control syndrome. And before she comes off the pill, she can start that protocol. So I hope that helps answer your question there. And then let me see, you're 2 weeks off the pill, including the placebo week. The past week, I've had terrible headaches and some night sweats. Is it normal for adjusting off the pill? Seems quick. So let me see. That's Lori. Lori, you definitely want to check out Beyond the Pill because yes, so post-birth control syndrome can show up a couple weeks after stopping hormonal birth control. For some women, it comes on later. It just really depends on what's going on. And it's another area where we need more research in women's medicine. So if symptoms peak after the pill at 6 months, when should they start to subside? When you start addressing the root cause of that. So that's the real talks there is that they can peak, but that doesn't mean that like they're going to peak and come back down if you're not doing some work to address what's going on. And that's what I teach you to do in Beyond the Pill. So I teach you to look at what is going on with your liver. Hormonal birth control impacts liver detoxification and it impacts your liver at both the genetic and the structural level. It also impacts your gallbladder, your gut function. It impacts your skin, your testosterone production, your adrenals, your thyroid, and all of this can lead to symptoms. And as we talk about mood, sometimes our mood is actually rooted in different hormones. It's not our sex hormones, but instead it could be your thyroid or your testosterone. So thyroid hormone, when that goes low or high, we can end up with anxiety or depression. As we were talking about with postpartum depression, understand that 1 in 12 moms worldwide will develop Hashimoto's thyroiditis in a form that's called postpartum thyroiditis. This is an autoimmune condition that causes women to go hypothyroid. Typically, they show up hyper, then they go hypo. And with that, that can be a cause of postpartum depression. So before we start jumping on a medication, we need to ask, is this indeed just postpartum depression, or do we have a root cause like thyroid dysfunction? Now, the other thing we can see is that with low testosterone, testosterone is your kick-ass hormone. It's like why you get up and you're like, I got this today and I have energy and it lasts all day. So when testosterone is low, we'll feel depressed, we'll cry a lot. When you're on hormonal birth control, that drops ovarian production of testosterone by as much as 50%, and it binds up your extra testosterone. It's also why we can lose muscle mass. We can feel like we cry, we have low energy, we have brain fog. All of that can be coming because of hormonal birth control. So we definitely want to be investigating the root cause of mood symptoms and understanding that a lot of the times when we have anxiety, depression, panic attacks, mood swings, irritability, it's usually the body communicating to us something else is going on. And as we know from research, nutrient depletions, inflammation, gut dysbiosis, so imbalance in your good gut bugs, that can contribute. Low testosterone, adrenal issues, hypo or hyperthyroid. I mean, I could keep going. Like right there, I just list 7 reasons you might have anxiety or depression. And it could be due to hormonal birth control. It could be due to what hormonal birth control is doing in your body. We have to ask the question why and what is true for you, and then make sure that we're addressing that. And that's why I gave you all the tips that I did of like, okay, here's the things that you can do right now to start healing your mood. If you're on birth control, you've ever had a history of using hormonal birth control. And yes, if you've ever used hormonal birth control, even if it was 10 or 20 years ago, if you haven't done the work to replenish nutrient stores and heal your gut, for example, those things don't just self-resolve, especially in this day and age when our food supply is more nutrient depleted and we are assaulted daily in terms of things that impact our microbiome. Antibiotics, pesticides, stress. You guys ever get stressed? I never get stressed. But stress is actually a really big thing. And then there's over-the-counter pharmaceuticals that actually impact our gut health and those good gut bugs. So understand that mood symptoms are not just all in your head, okay? They're connected throughout your entire body. And if you are someone who chooses to use an anti-anxiety or antidepressant medication, you're not a bad person, but you should keep investigating what else might be going on. Because sometimes, and I've seen this in patients where their doctor is like, oh, you're depressed. That's your main symptom. Here's an antidepressant. When in reality, they're hypothyroid, and that antidepressant makes the hypothyroidism worse. And so psychiatrists are a little ahead of the curve in this, more so than primary care doctors. And that psychiatrists tend to go, well, what's up with your thyroid? Especially if that antidepressant didn't work. And so even if you use a medication like that, it's still worth investigating what's your root cause and what's going on for you. And understand this doesn't have to be an either or conversation. It doesn't have to be a conversation where it's like you either take the drug or you don't take the drug. And if you take the drug, you don't investigate the root cause. And if you investigate the root cause, you can't do anything to get symptom relief. No, we can do all the things. Like you can tailor it to what you need. And the best way to do that is to work one-on-one with a licensed and experienced health practitioner who can write you prescriptions if you need them and help you discontinue them when you don't need them, while also investigating the root cause and making sure that you're getting the most comprehensive care that you need. Ashley, I see you're writing, thank you for all that you do with post-birth control syndrome. I was on the combo birth control pill for 5 years, decided to switch to Kyleena. That's a progestin-only IUD. And after 1 month, my anxiety was a nightmare. Word, girl, that happens a lot, especially with the IUD. And it's because for a long time, we thought, estrogen, she the devil, and the synthetic estrogen is the worst when it comes to birth control. But now we're starting to understand that progestin ain't so good for us. And so it can alter the female brain. And I will share some links with you of a new documentary that I'm going to be in talking about brain health, hormonal birth control, and our natural hormones. But progestin also is, raising the risk of breast cancer and other cancers as well. And so it's not just about what is in the combination pill. And understand, and beyond the pill, when I talk to you about contraceptives, I'm talking about all those synthetic hormones. They're synthetic hormones. They're not real hormones. They serve a necessary purpose if you don't want a baby, but they do have some side effects, and you deserve to be in the know on that if you decide to start taking them. So you got the IUD removed 2 months later. Thanks for that update, Ashley. Now you're 3 months free of hormonal birth control. I feel a world of difference, still experiencing mild anxiety every day. I'm taking vitamins and going to therapy. So I'm hopeful. I love that you're going to therapy as well. I think that's such an important point, Ashley, is that when we have mood symptoms, It's never like I talk to you guys about the physiological stuff. That's my forte. That's my arena. When you are my patient, you work with a mental health specialist as well, whether it's a psychiatrist, psychologist, counselor, something, because even if it starts off physiological, we can get into thought patterns that then make it where it's like, okay, our brain, we've actually wired our brain to work against us. And you can always rewire your brain and your natural hormones, estrogen and progesterone, help with the neuro Instagram. You can't see me, sorry. And then they have the synapse, and that's where they like fire, and you can actually rewire that and send it somewhere else. So instead of being like, oh, I said this thing and I think I'm stupid and like I hate myself, we all fall into that trap one time or another. We can actually rewire a brain of like, I said this thing and I think that was stupid, and next time I'll do better. And like you can actually rewire your brain and rewire your patterns and your thoughts, which I think is pretty cool. But you need your natural hormones to be able to do that. And so I'll be doing another session where I talk more about brain health and hormones, because we all need to be in the know on it. But for now, I want you to go ahead, share your comments. Let me know, was this video helpful? Were there aha moments for you? Or is there something else you want to hear me talk about in the future?